Okay.
In your personal opinion, do you think the Affordable Care Act is positive or negative for our nation, and why?
Well, there's no question that it is, in my judgment, that it has already been positive. I mentioned these young people who are still on their parents. We're taking so that the pre-existing conditions, you can't be denied health care. They're helping some senior citizens with their costs for their prescription drugs, which can be very expensive. Already, some of the prevention, screening, and wellness is part of the coverage. And we're working already on things like medical records and providing people choices. It's interesting, even before it's fully in place, the skyrocketing increase in health has been tempered. Costs are actually going down. They're not going up quite as fast. So it looks to me like a number of these pilot projects and experiments are already making a positive difference. The most important thing is that people now are starting to look at how we make the healthcare system work better. It's no longer a choice that we're just going to keep going along the way we were going with 40 or 50 million uninsured, paying more than anybody else in the world, and having some of the people who can afford it the least pay the highest costs. So it's a positive start, but we're not there yet. There's a lot of reform that needs to be done, and we need to do it faster rather than waiting for the next 5 or 10 years, because people need these changes.
And just another side note, so we talked about like how it'll be positive because it'll help more people be insured, but what happens to the people who are already insured? What happens to their health care?
Well, it will actually benefit people who already have insurance. What happens when all these people who don't have insurance get sick or get in an accident?
They get treated anyway.
But who pays that?
Taxpayers.
It's charged to the hospitals. They call it, quote, charity. But what they do is they pass the costs on to the rest of us. So your family has health insurance. You would be surprised at how much of the health insurance that you pay every year for your family is in part to pay doctors and hospitals for the, quote, charity care.
Right.
When somebody goes to a manual hospital in an accident and they can't pay for it, a manual has to pick up the tab some way. And the way they do it is by what's termed cost shifting. So they charge everybody else a little extra because they get stuck with stuff that they don't get paid for. It would be very interesting for you to do a little experiment. How much does an appendectomy cost? If you've got a friend who's 30 years old, uninsured, healthy, but said, well, I think I have enough money, or my parents have enough money, or I'll just pay for it if something happens. And they have to have an emergency appendectomy. They'll probably pay 4 or 5 times as much as somebody with insurance. Because if you're part of a health care plan, they'll negotiate with the manual. And so you're part of, Legacy, Blue Cross, Blue Shield. And they have a set amount that they pay people for appendectomies. But if you just walk in and don't have insurance, they'll charge you, full price, which might be 4 or 5 times as much. because of this cost shifting that I mentioned. So it's very interesting in terms of how much different people pay for exactly the same thing.
Yeah.
You trained her so well.
Okay, so we talked about how like the healthcare system in our nation obviously needs to get better and it has problems, and how do you think, like, what do you think will help reform that most, I guess? So you talked about evening the gaps, but I mean, is there specific action?
Well, it's kind of hard to pick this up when you listen to all of the crazy stuff that's going on.
Yeah.
Because it's everybody's, it's pretty heated debate.
Yes.
And then there's weird stuff, like somebody's writing an article that the goal is to insure illegal immigrants,
Yeah.
which is a lie, but somebody's writing it because they want to spook people.
Right.
One of the good things that's happening is that more and more people are looking at facts. And we've reached a point where people understand we can't keep doing what we've been doing. We can't afford Medicare that goes up, and private insurance is going up even faster. So businesses are dropping the coverage now. So if we don't do something on a big scale, insurance costs are going to go up and coverage is going to go down, because we're seeing it now. Businesses are being forced to drop coverage because they don't think they can afford it.
Right.
From what I find interesting is that more and more people now are looking at some of the claims. There's a great book, and I'll give you the author's name and the citation. Rich Reed is an Oregonian, actually, who wrote, he had a bad shoulder, and he took his bad shoulder to about 12 different countries and used his bad shoulder as a way to see how their healthcare system, how they'd be treated, what they'd be charged, because a lot of what we hear about, the Rush Limbaugh type stuff is just not true. And almost all of these countries, they actually like their health insurance, their health programs. France, Canada, Great Britain, Japan. They actually, everybody has some things that they disagree with and they'd like better. But every country kind of likes what they've got because they're used to it. In this country, it just it's just people are starting to recognize that we need better. We need better performance. We can't keep spending as much as we're spending, and that there really are things that we can do that are better. So I find this very positive. And I do think that over the course of the next 10 years, we're going to do something very similar to what the healthcare reform is, because this is most of these things were not that controversial. Coordinated care, we're going to stop paying for every procedure. Right now, we pay for volume. The more tests and needles and tubes and operations, the more the doctor or the hospital makes.
Right.
We're going to change that to pay for value, for a result. We're going to pay you to heal somebody and keep them well, rather than just pay for lots of stuff.
Right.
We're already seeing, for example, in Miami, one of the reasons Miami costs a lot more for its senior citizens than here is because the doctors there that people have more doctors, and the doctors do more things to them.
Yeah.
But it's kind of funny, they're not healthier.
Right.
In fact, and sometimes when you've got a dozen different doctors all doing something to your foot or your nose or your back, your allergies, things fall through the cracks. And sometimes what one doctor does isn't coordinated with what another doctor does.
Yeah.
And can create problems. So for me, that's going to be one of the great reforms, is that we're going to, this next 10 years, we're going to pay for medical care value rather than just volume.
Right. That makes sense, yeah.
Your hands are steady.
I know. I was asking her if she wanted to stand, but she said...
My elbows are on this thing, so...
Pretty steady.
Okay, and then how is our nation going to pay for the Affordable Care Act?
Well, one of the things that people lose track of is that we're already spending 17% of our gross domestic product on health care.
Mm-hmm.
It's a huge sum.
Yeah.
And it's more than we need to spend. So what we need to do as a country is to take that money that we're spending now and spend it differently. We can do a better job with prescriptions, medication. They are much more expensive for our senior citizens than for our veterans, even though they're both government programs.
Right.
That doesn't make sense. So why can't we give our senior citizens the same prices that we give our veterans, since tax dollars are paying for both of them?
Right.
If we are working to reduce the unnecessary preventable hospital infections, they're very expensive and do kill 100,000 people a year, or readmissions to the hospital. We've got some things that are going on now where there is a penalty if somebody who's been discharged comes back within 30 days for something that's preventable.
Okay.
It wouldn't count if they were in an accident and they came back. But if they get an infection because the surgical dressing doesn't or changed. So what they're finding is that by rewarding people who have better outcomes and penalizing them if they don't, that you can get better care at lower cost. There's an independent bookkeeper, scorekeeper. They call it Congressional Budget Office.
Okay.
And their estimate is that over the next 10 years, we will save $100 billion with these reforms. And over 20 years, we could save over $1 trillion. When people ask, how can you pay for this? They need to do one thing first, and that is, what is it going to cost us to do what we're doing now? And it's already costing us more than it should. And if they throw this out, the costs are just going to go up, and it's going to cost us more for insurance, it's going to cost us more for taxes, and individuals are going to pay more. So from my vantage point is, we as a country shouldn't pay more than we're paying now.
Yes.
We should pay it differently.
Okay.